Hi, this is your host, Nurse Choma, your NCLEX prep coach. And today I'm going to be talking about 3 tips to help you pass your NCLEX exam. So hopefully you find this helpful and hopefully you get some understanding from listening to this. Now, tip number 1, okay? Because some of you, one of the things that I want you to understand, for many people, when you say you have problems with eliminating the choices or you have problems with knowing what the question is asking you, then it's a sign that you don't understand the content very well, right? That's what it really is. It's not that the question is tricky. The issue is that you don't understand the content like the way that you need to understand the content. And if you don't understand the content very well, then the next to that is that you may not understand the function of the different organs of the bodies. Okay, so one of the things that I recommend, the tip number 1, is to make sure that you understand the function of different organs of the body. Okay, so for example, what does the brain do? What does the heart do? What does the liver do? What does the pancreas do? But the issue though is that you may know generally what it does, but you may not be able to verbalize it, and you may not be aware of what are the nursing precautions attached to it. So for example, what does the liver do? The liver metabolizes and excretes. The liver also is where the clotting factors are housed. So as a nurse, when you're monitoring the liver, or you're concerned about the liver being impaired, you would monitor their PTT, their INR, their PT, right? You would look for signs of bleeding. Right? These are some things that you would be aware of because you understand the function of the liver. Okay? So that's tip number 1. Understand and verbalize the different functions of the organs. Tip number 2. Know clearly the difference between the RN, the LPN, and the CNA, or the unlicensed personnel. Right? One of the issues that a lot of you struggle with when it comes to management of care or priority questions is that you don't really have a very clear understanding between these 3 roles. So you want to make sure that you know exactly everything the RN can do, you know what the LPN can do and cannot do, what the CNA can do and cannot do as well. Notice how I said at the end, and cannot do. What some of you may not be familiar with is what they cannot do. You need to know that. Tip number 3, all right? Tip number 3, have a strong foundation, okay? One of the issues that a lot of people are not passing the exam is that your foundation is weak. So even though you're doing question, you're not passing your exam because your foundation with the content isn't strong enough. So the stronger you are first with the content, the better you will do with the questions. If you focus on the questions before you really master the content, you're missing things. There's different aspects that you're not aware of, and that's why it's making it so challenging, and that's why you're not able to eliminate the choices, and that's why you feel like the exam is tricking you, because you don't really understand the content fully. So you want to set that foundation right first with the content and then to the questions. Okay? So I hope you understood what I shared with you today. One thing I want to encourage you, if you find this helpful, if you want to get more information from me, then I want you to join my free training called How to Pass Your NCLEX Exam in 30 Days. Yes, that's right. And you can simply sign up for this by going to the link freetraining.choosenursing.net. All right? freetraining.choosenursing.net. And I will see you there. All right. Have a wonderful day. Bye-bye.